We're seeing a lot of cardiology in the crosshairs. We know, and we've seen, I think, all too much of this over these last couple of years, as well as over these last couple of days. We know the pressure that interventional cardiology, is under. That was part of the backdrop that drove us to do this. There are issues of loss of revenues with reduced referrals, challenges negotiating with payers, and then increased costs of insurance, media, legal issues. All of these were concerns that were going on at hospitals and amongst patients in the 2011 era. Now in 2013, happy we did this because I think we felt it set the stage for us moving forward with some of the changing pressures that we are under in interventional cardiology and cardiology in general. And, we thought we were doing well. But we thought an external validation and look at that would be to our benefit. And we looked at this cath lab accreditation as really a comprehensive look at everything we did in the lab. I mean, there were areas of focus, and I'm going to go through that, but leadership structure, the use of our reporting structures, the procedure indications and consent processes, outcomes, quality peer review. I won't go through that whole list, but we just looked at this as an opportunity to look at everything we did in the cath lab and potentially make it better. So if we were doing this well, again, why did we do this in 2011? We pretty quickly learned, there were some things we should be doing that we weren't. And this included appropriateness. Again, this was new at that time, but I think a real struggle with how to implement the appropriateness criteria in the cath lab. And again, we've heard some great talks on that topic, although I think it's still a challenging process as I look at that. Conferences, quality assurance components, staff credential requirements, and audits. There were gaps that we learned about. We thought it would elevate everything and everyone in our cath labs, that it was a comprehensive program that would bring together the varied components of our cath labs. We had consolidated 2 separate hospitals and different cultures into one center a few years before that, and we're still struggling with some of those consolidations. We had gone through many other certification processes so that we could react to that or we could lead the way. So these were the reasons we did this in 2011. So a process. Some of the things we learned, a process to improve case review, gain an outside perspective with no insider bias. Bonnie spoke to that very nicely. And then to focus at the issues that were on the forefront of all of our minds.